Hello and good evening, everybody. I'm Dr. Gauri and I welcome you to the Brainchild Trust session today by this amazing speaker. I'm sure you'll have a good session today. I hand over Kritika to start the session.
Good evening, everyone. I welcome you all to the 6th academic session hosted by the Brainchild Trust. Our speaker today is Dr. R.M. Sundar Kumar. He is the Director of Therakainos Pediatric Therapy Specialist in Bengaluru. He has about 20 years of experience in the field of pediatric physiotherapy and has certifications in general movement assessments, neurodevelopmental therapy, and sensory integration. I'm sure we all look forward to your presentation, sir. All the best.
Thanks a lot, Kritika. I extend my thanks to Brainchild Trust for giving me this opportunity today to share my experience of behaviors in children with autism with you all. Let's dive into the topic. The biggest question, every time when I see people coming and asking me is, okay, this is the problem with my child. Tell me whether it is sensory or behavior. I would always say that no, that is a pretty wrong question. I will tell you why. You can never compare sensory and behavior. Every little thing that you see is a behavior. You should start counting it as a behavior. Now, say for an example, a child walks into your clinic or your child is doing a tabletop activity and he completes a puzzle. He or she completes a puzzle. That is a behavior. When your child refuses to participate in an activity, that is a behavior. When your child shows a tantrum, that is a behavior. Probably you can classify them as these are good behaviors, these are challenging behaviors, right? So a comparison of whether it is behavior or sensory is like starting it from a wrong place. Now, what I'm trying to emphasize is every single thing you see in a child should be counted as a behavior. It could be good behaviors or it could be challenging behaviors. Now, that is the first place that we should start. That's number one. And number two is then the question comes, now where does the sensory fits in? That is why I put this beautiful behavior box. If you look at this behavior box, all the challenging behaviors would have an underlying reason. And that is the reason that when you open the box, you would see all these reasons that is there in front of you, right? It could be sensory, it could be arousal, it could be self-regulation. It could be a noisy thoughts that goes inside the child's brain. It could be novelty, it could be environment, stress, emotions, focus, distraction, communication. It could be many things that can cause this challenging behavior, right? So sensory is one of the reasons that causes this challenging behavior. That is how we should start looking at behaviors. So if a family comes to me, sensory is something which I would think at the last. I would not put every single behavior, okay, this is sensory. Oh, a child flaps hands, oh, probably this is sensory. Oh, a child looks at the corner of the eyes, probably this is sensory. A child who is moving from one room to another, oh, he's looking for movements, so this is sensory. So this is something that we would not try to address it in today's session. I've looked at all your questions when you have registered it. Some of the questions are very specific that we would not be able to address it because each and every behavior is individualized. It needs an individual attention. So there is no general recipe for each behaviors. It depends upon the child, how the child responds, right? So the point here is, please understand this. I'm re-emphasizing it again, right? Challenging behaviors, each thing that you see in a child, you're counting it as a behavior. And if you find a challenging behavior, you're trying to identify what is the underlying cause or an underlying reason for these challenging behaviors. Remember that there could be many things that can contribute to those challenging behaviors, right? It's not that simple. It is damn complex. If you look at this box inside, all that I've detailed inside this box are linked to each other. Somebody can ask me, Is not self-regulation linked to anxiety? Is not anxiety linked to the sensory modulation? Is it not novelty associated with the environment? Yes. That is why it is so complex. It is very difficult to know, identify it. So I'm going to give you some ideas today to identify how do you identify what is the underlying reason for those challenging behaviors and how do you work with your child, right? Let's move on. Okay, so the second question is, do we need to treat behavior? Now that is something which you need to understand, right? Remember, not every behavior needs intervention, but every behavior needs to be understood. Now, this is something which I would emphasize to all my families walk into my clinic or all the therapists I speak to. I always say that every single behavior needs to be understood. If you're not understanding why this child is behaving in a certain way, then it is going to be extremely difficult to help them with solutions, or it is going to be very difficult to know problem solve to overcome those behaviors, right? So remember, every single behavior the child exhibits needs to be understood. So that means you need to do a lot of an observation, a lot of an analysis, create a lot of an hypothesis to see why the child is behaving in a certain way. Okay, so what are we treating? Now, we are not, please remember that we are not treating behaviors. Behaviors are the outcome or the expression of the underlying reason. So in the middle segment, if you see, these are the underlying reasons. Now, it is not limited to these underlying reasons. There could be many beyond this, but I have put general underlying reasons that can cause problematic behaviors or challenging behaviors, right? Now, I'm not going to treat, now, for example, I'm not going to treat flapping hands. I'm not going to work on rocking and bouncing or flicking fingers on hand pulling, but I'm going to identify the underlying reason that is causing all these behaviors. So in the left-hand side, if you see, these are repetitive behaviors, restricted repetitive behaviors on the left-hand side. But if you see on the right-hand side, you see self-injurious behaviors, right? So you have restricted repetitive behaviors and then self-injurious behaviors. All can have a similar underlying reason. We do not know, but please remember that it is important to understand the underlying reason. When you understand the underlying reason, it is easy to help the child to go through those behaviors or make accommodations for those behaviors or help the child to come out of those behaviors. But if you're going to directly start treating flapping hands, then probably it's not going to work. If you're going to directly start treating head banging, try to see how do I stop head banging? Okay, I would keep telling the child that no, you should not bang your head, right? So many times I see families and then therapists work, try to do restrain to control behaviors. And I would talk about restrain a little later, why restrain doesn't work in children with autism, right? So it's remember to ask this question, what are we treating? Are we treating the underlying cause? Are we looking at the underlying cause, underlying reason and help children to overcome those behaviors or help them to accommodate to those behaviors, or we are treating those behaviors directly? That is something which we should keep asking ourselves, right? The next one is, many times when I ask a family a question, now tell me why your child is doing this behavior, right? Many times, the family tells me that I think there is no reason for this behavior. He can do it at any time. Even if he is simply sitting, he would do it. Even if he is not just walking, he would do it. Even if he is not doing a tabletop activity, he would do it. There is no reason for this behavior. That is something which I often hear from the families, but that is not true, right? The fundamental important principle is this, that every behavior has an underlying reason to it. The only difference is that I don't know what is that reason. That is why I say there is no reason. Okay. When we don't know what is the reason, it is always easy to tell us that, no, I don't think that, there is a reason for my child's behavior. Always you should start from a point that every behavior has an underlying reason to it. And it is important for us to identify those reasons. It's not easy at the first glance to pick up a reason or a cause for the child's behavior. It requires a lot of observation to come to an hypothesis, what is causing this behavior. So generally what I would do is, I'll ask the family to maintain a log and then ask them to write in the log that everything that happens around the behavior when the behavior is happening. So they record everything like an ABC form. Many of you would know what is an ABC form. So similar like an ABC form, I will ask the families to maintain a record, and at least I'll ask them to record 10 such incidences. Then we would look at those 10 incidences and try to understand that what is causing this behavior. Generally, if you maintain a log of 10 occurrences, at least you would come to a point of identifying what could be the underlying reason, right? So the point that I'm trying to emphasize is every behavior has an underlying reason to it, right? So now one of the most commonest thing is the restricted repetitive behaviors, which we call it as RRBs, which is also known in some literature called as stimming, right? What is this restricted repetitive behavior? It is identified as a repetitive rhythmic behavior that can be commonly expressed through body movements, vocalization, or probably a visual seeking behavior, right? I can flap hands, that is a body movement, right? If I spin around, that's a body movement. If I keep humming, muttering sounds, or I'm trying to do a verbal scripting, then it is a vocalization, right? All these come as a part of restricted repetitive behaviors. These restrictive repetitive behaviors are self-stimulatory in nature, right? They try to self-stimulate for various reasons that we will see a little later. But remember that, right? That these are self-stimulatory. At times, they are involuntary and unconscious, right? At least at the beginning, it is involuntary. It appears to be involuntary. If you look at the literature of restricted repetitive behaviors, most of the times, the literature documents it as an involuntary behavior. That means they are not under control. It is not under their control, or they are no voluntarily, actively initiating this. Sometimes there is a need that forces them to do it, but most of the time it is involuntary, at least at the beginning of behavior. What does that mean? If I self-stimulate over a period of time, it can become a habit. Then it could be a voluntary will. But at least when the child starts doing this behavior, most of the times it is not voluntary. It is without their conscious, they initiate these behaviors, right? So that is about repetitive restrictive behaviors. Why do children do this repetitive behaviors? Number one is when the environment is absolutely overwhelming. Now they go into an environment and the environment is absolutely overwhelming. It could be of any reasons. Now I've seen children walking into my session, and suddenly when they see another child and the therapist working in the same room, they get overwhelmed. And then they absolutely start stimming more, right? So that could be one reason, right? I'm just giving you reasons, right? For you to understand this. But why children do this restricted repetitive behaviors is, there could be many reasons. And some of the reasons I've highlighted here is, they do stimming if they want to calm themselves. Now, if the environment is overwhelming, then what I need to do is I need to calm myself. That's number one. If the environment is overwhelming, I may use a distracted strategy. I wanted to distract myself from the ongoing activities so that I will calm my body down. That is number two. Number three is, I've seen children who can focus better when they are involved in stimming behaviors or repetitive behaviors, right? Now, for example, I have a child who would vocalize a lot when he is doing an activity. It doesn't disturb his activity in any way. You would not see him doing it when he is moving around, when he is on a swing, when he is on different kinds of swing. He doesn't make those vocalizations. But when he is focusing on a tabletop activity, you see that his verbalization goes up. Now, why does he do it? Probably since it is not affecting his activity, he's absolutely doing this activity, whatever you ask him to do. The only meaningful conclusion you can make it out of it is, probably this particular humming that he is trying to do is basically helping him to focus on that particular activity. So do I have to really stop it? I would not stop it if it is really helping him to focus. But if it is, he's using it to calm and distract, then I would analyze it. Why he has to calm his body down? Is there something in the environment that is really disturbing him? If I control the environment very well, will he be able to focus without engaging in those repetitive behaviors? That is how I would start thinking, right? But why this repetitive behaviors are a problem? Because everybody believes that it is socially inappropriate. But the question I always ask is, it is socially inappropriate for whom? Do you think it is socially appropriate for the child? No, absolutely not. The child never even thinks that, no, it is socially inappropriate. Even young adults with autism, they don't think that it is socially inappropriate. Why it is not socially inappropriate for them? Because this behaviors are actually helping them to either calm, distract, or focus. So it is not socially inappropriate for them, but for whom it is socially inappropriate? For the onlookers, right? For the caregivers. When the caregivers look at the child stimming, they will always feel that, okay, this is awkward. What would happen when others think about my child doing this? So it is awkward and inappropriate for a caregiver or onlookers, but not for the child. Why it is not for the child? Because the child is trying to organize his own body, right? So that is something which we have to be aware of, right? Now, the most important thing is there is no reliable methods to treat repetitive behaviors. Do you have any reliable method? Absolutely no. I do not know. In a span of 20 years, I have not found one reliable method to treat those repetitive behaviors. Right now, that is something which is just very important. Some of the literature would even advise that it is an impossible task or it is very challenging to completely take off these repetitive behaviors, right? But we are going to talk about few things. Don't think that, okay, now I've come here and then you're saying that, no, there is no reliable methods for treating this behavior. Why am I even attending this program? No, we are going to talk about certain strategies that we need to follow so that we can we can find the best way to manage these behaviors, right? Using a restraint method to stop can pop back behaviors in a big way. Now, I have a child who is not 12 years old, is going to this particular school, and he has this particular stimming behavior. He flicks his hand faster and keeps looking at it. Okay, he will either flicks his hand or he will find anything which is flickable. Now he can hold his t-shirt and then keep flicking it, right? He can, if he finds a rope, he would start flicking it. So he would go to a curtain. If the curtain has a rope to pull up, he will hold that and keep pulling it. He would do, if he will find things in the environment where he can keep flicking it. That is his repetitive behavior, and it is absolutely taking away time to focus on other things in life, right? Now, this boy goes to a school and the school practices restraint method. What is the restraint method? They try to absolutely block this behavior. They try to tell him that no, quiet hands. Sometimes they tie his hands and make sure that no, he doesn't do this behavior, right? Now, that is for almost 5 to 6 hours a day, right? He does it for 5 to 6 hours, and then after 5 to 6 hours, he walks into my session. Now, when he walks into my session, what happens? The stimming behavior goes 5 folds up, and he starts doing it more now. Okay, now you think that no, you have restrained it, but it boomerangs and then comes back, but it comes back with a super high intensity. So restraining method is always not a great choice of a therapy method or an intervention method in trying to reduce stimming behaviors. Please understand this, right? Okay, so so I would say there are alternative other methods rather than no restraining, because if you restrain, say for an example, if you're flicking and then you're restraining it and then the flicking goes off, imagine the flicking goes off, it is going to come in another way. This behavior, after some time, the child will start doing some other repetitive behavior that will be much worse than flicking fingers, right? So please understand that restraint method is not a great choice. Now, another example that I wanted to give you is, there is this one particular child who walks into the session. And whenever he is anxious, he will hold his hands together and make a noise. Okay, now, why does he do it? I said it is anxious. How do I know it? I have made several observations to come to a conclusion that whenever he is anxious, he does it. He not only holds his hands together, but he also makes an humming noise. That humming noise is very specific when he is upset. And there is a different humming noise when he is happy, right? So it needs a lot of an observation for you to understand these behaviors. So what is the most important step to stop this? The most important step to change this is basically to create an environment that is anxiety-free for him. So for that, what I need to do is I need to understand what is causing him an anxiety. What is that in an environment that is making him panic? You would say, okay, movement is panicking. No, it could be anything. It could be absolutely anything. One example I would give you is another child who was around 13 years old. This family said he does not sit with me for a tabletop activity. Okay, now this is a problem specifically happens at home. In school, the teacher does not complain because in school, he sits for a tabletop activity, does it beautifully well. I have not observed when I do a tabletop activity with a child, I did not see him resisting a tabletop activity, but specifically in the house, he resists for a tabletop activity. So you do start analyzing the environment, the behavior of the parent. You start trying to understand, make observations. And then at last we have identified it. The LED lamp that's just hanging in front of him, close to him, over the tabletop is really no panicking him. Okay, we have removed that LED light that is exactly hanging close to him. And that's it. Voila. He started doing the tabletop activity every single day without a fuss. You understand this? This is how you start looking at behaviors, right? There is no ready-made recipe. You should start observing, making an observation, find an underlying reason, establish an underlying reason, and then start working on it, right? So that is about restricted repetitive behaviors, right? Now, this is a beautiful list of references. I don't know whether if you have not read about this, I would want you to read, note these references, take a printout, have a copy with you. All these references that I'm giving are open access. You don't need to struggle to get it. If you go Google it, or if you go to those publisher website, you can freely download all these articles, right? There are many articles, but I'm putting these 3 articles which are very important, which talks about the experience of young adults with autism and what they think about these behaviors that they do. If you read it, it is a beautiful, empowering experience when you read all these articles, because this is going to open up your mind to say, okay, now this is how they do this. Because it's important for people like young adults with autism to come and share their experience of what they think about these behaviors, especially those restrictive repetitive behaviors. Why do they do it? In what situations they do it? If you understand that, it's going to be much easier for you to start looking in your child, why the child is doing this behavior in a certain way, and then how do I help this child to manage these behaviors, right? So that's the list of references. Most of the things I'm speaking has a relation to these references because some of these I've used in this presentation. So it's good to read these references, right? And now this is a neurobiology. Why neurobiology of specifically why children with autism engage in repetitive behaviors? I will not go into it. I know that some of the parents are sitting in this. I don't want to talk about too much of a medical thing, but look at this. This is not a very established concept. Okay, there is a direct and an indirect pathway between the cortex, basal ganglia, thalamus. There is a feedback loop between this circuit, and this circuit has a direct pathway, indirect pathway, and a hyperdirect pathway. Imbalance between the direct, indirect, and hyperdirect pathway can result in a motoric repetitive behaviors. Now, when I say motoric repetitive behaviors, hand flapping, flicking, looking, staring, looking at the corner of the eyes, arranging things in line, the arranging objects in line, all these are motoric behaviors, right? So these motoric behaviors manifest if there is an imbalance between the direct and indirect pathway, right? So with that, I will stop, but there is a reference that I've given. You can go and read about it. This is not a well-established concept. This concept is pretty much done in animal models, but no, we have very little evidence, but it is a very good pathway to explore to understand why these repetitive behaviors exist in children with autism, right? Now, another thing that you have to understand when we understand behaviors is child's arousal, right? Now, look at the center part of the screen where I put a green rectangle frame. Now, that is where you want all your children to operate, right? Calm and alert. Sorry. Calm and alert. Calm and alert is an arousal state where I am ready for learning, remembering, having a clear thinking, and making good decisions. Now, if a child walks into your clinic, if you are a special educator, you want child to be in the space when they are walking into your clinic or walking into your session and you're ready for tabletop activity. If your child is calm and alert, they are going to do everything. They are going to come here and then sit and learn, do all their activities good. And this is where we want children with autism or ADHD want to operate in this space. But unfortunately, what happens is a child with an autism would never stay in this calm and alert space, right? They are either over alert or they are under alert or in their sleep states. Now, before dwelling into this topic, I would try to make you understand it. Arousal is nothing but it is wakefulness, right? How wakeful you are. You can categorize into you are sleepy, you are alert, and you are over alert. Keep those three levels in mind. You are sleepy, that means no, you're very tired and exhausted. You don't want to engage in an activity. Now, if you're very sleepy, you would not be able to perform well, right? That is the as good description as it is, right? So when you're in a sleepy state, you're not going to perform well, right? When you're in an over alert state, you are proactive, right? Your body systems are in flight and fight mode. When your body systems are in flight and fight mode, generally what I call it as an anxiety mode or a stressful mode. If a child is in an anxiety or a stressful mode, the child will not function well. And it is true for anybody. It is true for you and me, right? If I'm going to be in a very stressful mode, I'm not going to function well, right? So either it is a low alert state, or it is a calm and an alert state, or it is a high alert state. Now, you always want your child to be in calm and an alert state. Now, that is where they function the best. But the problem with children with autism is they have fluctuating arousals, right? At one time, they would be under alert. At some time, they would be calm and alert. At some time, they will be over alert. Now, this is something which is very important. That is why I would say, okay, your treatment sessions are extremely dynamic. A child who walks in today would be calm and alert, and then he would do the best in the session. But the next day when he comes, probably he is under alert. If he is under alert, he is not going to sit on your tabletop and do your activity. He's going to be he is going to look for things that will improve his alertness. Now, what he will do, say for an example, a child is under alert, walks into your clinic, or walks into your session, what he would look for to improve his alerting level is one of the go-to things that he would do to improve his alertness is movements. He wanted to go and swing and swing and swing, or jump on a trampoline and trampoline and trampoline, and try to get that alert level higher up in this hierarchy, right? Now, but there is a problem there. Okay, now think about a child. This is something which I've extremely seen in children with autism. They come inside, they are under alert. Then you say, okay, let's jump on a trampoline to improve your alertness. The child goes and jumps on a trampoline, say for 15-20 minutes, he is jumping and he doesn't want to come. Our child does not understand, our children with autism does not understand when they approach the calm and alert state, they should stop this. They do not know this. So what they do is they overshoot and go into over alert state. If they continue that activity, what they would do is they would go beyond the over alert state and go into a shutdown mode. I have seen children, they come, they will jump on a trampoline. At some point of time, suddenly they get upset and then they become quiet and non-responsive. Now, what does that mean? They've already gone into a shutdown phase, right? Now, why this is very important is because this is important for why is because I need to know what is their arousal level, what is their alertfulness, and I have to tune my activity based on their alertness. This is very important. Please understand. This changes every single day. Now, what does that mean? Changes every single day. Today, a child comes with calm and alert state, will come under alert tomorrow, but the very next day, he can come into an over alert mood. So what you need is you cannot have the same treatment strategy every single day. You have to look at their arousal and tune your activity based on their arousal levels. Now, imagine this. Okay, a child, you're working with a child. If you are a parent, you're sitting with your child on a tabletop activity and the child is disinterested in the tabletop activity, but he wants movements. What does that simply mean is probably is under alert. He was looking for movement. Now that is something which I have to observe, right? It comes through observation. There is no specific scale or a method that you would use to identify this arousal. But if you start looking at their arousal levels, you would start picking up that skill of looking at what is their arousal state. This is something I would do with every child walking into my session. Right? If a child is under alert, if the child is over alert, I will not do a tabletop activity with them. But what I would do is I would instead, if they are under alert, I would start using movements to improve their alertness. If they are over alert, what I would do is I would try to calm them down so that I would bring them back to the calm and alert state. Now, say for an example, if a child walks into your clinic over alert, first thing is I would not start. If I'm a special educator, I would not start with a tabletop activity. What I would do is I would use calming strategies that are specific for the child, calm the child down, and then start initiating a tabletop activity. If I do that, what I would be absolutely successful in each and every session, right? Now that is very important, right? Okay, so that is about the arousal levels. Every single day, it's important that you monitor the child's arousal level. And what you want is you always want the child to operate in that calm and alert state. That is the state you want them to operate, but it is going to be very challenging. Every time when they shoot up and down, you are going to bring them back to the calm and alert state. The more you help them to stay in that calm and alert state, it becomes habitual for them over a period of time, and then they would be successful in every task without losing their arousals much into an over alert or an under alert zone, right? So that is about this arousal. Okay, we will go to the next thing is categories of sensory integrative dysfunction. Now you look at this, the most important thing that can be related to behaviors are sensory modulatory dysfunction. Don't worry about dyspraxia. That is not something which is going to land into behaviors, but what will land into behaviors is sensory modulatory dysfunction. What is sensory modulatory dysfunction? Ability to modulate senses that is available in the environment, right? A child can be under responsive or child can be over responsive. What is over responsive? Over responsive means child is very sensitive to certain kinds of sensory information in the environment. It could be anything, right? What is under responsive? Under responsive is child does not perceive senses that is there in the environment. It is nothing to do with the skin or ears or eyes. We are not talking about that. We are talking about the brain's ability to process this information. Your brain does not have enough ability to process the environment, process the senses in the environment, then it is called as under responsive. If a brain is processing every information, every little information in the environment and trying to pick up every senses and thinks those senses are harmful to you, then it is sensory over responsivity, right? So There is an under responsivity where the brain is not processing it enough. Over responsivity is the brain is too much processing the information, right? So now, will that affect behaviors? Absolutely. These things would affect behaviors, right? Now, if you look at the sensory modulation, it's a continuum, right? What is a continuum? Today, my child is under responsive. Some other day, he can become over responsive. Is that possible? Absolutely, yes, right? An under responsive child can look for sensory information in an active way or a passive way. Okay, now what is an example here? I will tell you. What is under responsive? Under responsive is the child is not perceiving enough sensation from the environment. Say for an example, the child does not perceive enough movement senses from the environment. So what they have to do? They have to look for movements. They wanted to move. They wanted to jump. They wanted to run. And then they wanted to always look for movements. So that is under responsive. If they are actively looking for movements. Now, there are certain children who come to my clinic, they would wait and then they would not be able to wait. They are excited and then they want to just get in. The moment they come in, they want to get in and then look for all kinds of movements. They want to go into the lycra swing. They wanted to go onto the platform swing. They wanted to jump on a trampoline. They wanted to climb up and then jump. What they are looking is they are actively looking for this movement sense. So children who are actively looking for this movement sense in the environment, they are called as they are classified as sensory seeking behavior. This behavior is called as sensory seeking behavior. But there are children who is not feeling enough movement from the environment, but they are very passive. They need somebody to get them to do all these movements. When you come them, they are lying on the floor all the time. As if they do not have any energy. They do not have any strength to do anything. But the moment you help them to explore these movements, and then they start enjoying these movements. Those are the children, you call it as very passive under responsive. And those are the children who are classified as low registration. So in under responsive, you see two categories of children. One who is actively looking for movements. One is very passive. He needs a caregiver's help to register information in the environment. Those children are called as low registration behavior. The other end of the continuum, you see over responsive. Over responsive means they are very sensitive, right? A child who is actively managing the sensitivity or called as avoiding. Now, one simple example is the pressure cooker sound, right? Now, some families will say the moment the whistle pressure cooker sound comes, he runs away, goes to the bedroom, which is at the other corner. He runs inside that room. What is this behavior? This behavior is actively avoiding it. Okay. Now, I know this sound is troubling me, but I'm going to actively find a strategy to avoid this. Now, that behavior is called as an avoiding behavior, right? The next one is a passive child. What is a passive child? He looks at the pressure cooker sound and starts standing there and crying. He doesn't know what to do. That is a child who is very passive, who are classified as sensitive behavior. So you have a seeking behavior, you have a low registration behavior, you have an avoiding behavior, you have a sensitive behavior. This is how you would classify a child with sensory modulation deficits. And a child with sensory seeking behavior, a child with all this, not only sensory seeking behavior, all kinds of behaviors will exhibit general behavioral problems. So that is something which needs to be managed, right? So we'll go to the next slide. This is what I need to talk about: a overwhelming environment and sensory overload, right? Now, this is a beautiful an infographic that is published in one of the articles. I've given the information there. It's a graphical representation. I want you to focus at the center. Center is what you call it as sensory scape. The sensory scape has three things in it. If you look at it carefully, it's called a sensory burden, sensory inescapable environment, uncontrolled environment, right? Now, what are these things mean? I'm not going to discuss about all, but I'm going to discuss about few in this. Sensory burden. What is sensory burden? if a child is in a multi-sensory environment, what do you mean by multi-sensory environment? Say for an example, there is a sound that comes from a fan, but there is also too much of people in the environment. There is too much of a crowd in the environment. There is also a sound coming in. That is multi-sensory. A child cannot handle it. It becomes an overwhelming environment. What the child would do is the child would start showing behaviors. These behaviors can be a meltdown or a shutdown or a tantrum or suddenly becoming lethargic, or the child can show self-injurious behaviors. It could be anything. So what I need to do is I need to start analyzing the environment. What is this in the environment that is causing a problem? Is there a multi-sensory information in the environment that is making this child behaving in a certain way? Why this child is behaving, right? That is something which I need to know. That's one thing. So sensory burden is basically saying that a multi-sensory environment can be overwhelming, right? Now, your sensory integration room for all your therapists can become an overwhelming environment for certain kids. I've seen kids walking into the clinic, suddenly looked at people inside the sensory integration unit, suddenly looked at all the hanging equipments there and becomes extremely nervous and anxious and starts showing a lot of stimming behaviors. What is that called? That is sensory burden. Now, I need to understand it. This child has an overwhelming episode looking at this environment. What I need to do is I need to minimize this environment and make the child extremely comfortable in this environment, right? A sustained and an inescapable environment. What is a sustained and an inescapable environment? I have to live in this environment for the next 45 minutes and 90 minutes. I have to sit with my mom and do a tabletop activity. This is too much challenging for me. It's a sustained and inescapable environment. Now, I'll give you an example. This one particular child, a very similar child, when I talked about this child who had a visual problem, LED light hanging on the tabletop, this same child, one day he walked into my class and then he simply refused to come inside the class. There is something that was really bothering him. We did not find what is bothering him, but he refused to come inside the class. So I made a repeated cognitive pleas to him, whether he can come and do this activity, or I gave him a choice of an activity for him to do. But nothing worked on that particular day. He simply said to me that no, he wanted to go back home. Then I said the family to take him back home. Okay, so the family took him back home. The next session he comes back and he does the same thing. He did not want to come inside the class. He said, I want to go back home. I again give him options for him to do things that he likes usually in the session, but he said, no, I wanted to go back home. Then I said the family, okay, again, we will cancel this session. We would see the next session. Then the family asked me a question. Are you not training him to learn this so that no, he would learn this? Okay, if I tell sir, no, I don't want to come inside the class, probably he will send me back home. Will it not become a learned behavior? I said, it will become a learned behavior if this child is typically growing. But it is not going to be a learned behavior if a child has a diagnosis of autism. That is my opinion. Most of you sitting here may differ from it, but this is my opinion. So I told the family, we will cancel it today. You can come back next session, we'll see what happens. The next session, when he comes in, he does the activity so beautifully. Okay, he did not resist. He followed my instructions very well. And he did the entire activity. From that day till the completion of his sessions, completely discharging from the sessions, not even once he resisted coming inside the session. Now, that 2 sessions gave an enormous trust. I've developed an enormous trust that he has started believing in me that this man would not do anything that would be harmful for him. Now, that is what is all about sustained inescapable environment. I have not sustained that environment. I have not given him an inescapable environment. I have provided an escapable environment. Oh, is there a problem for you today to be a part of the session? Okay, let's understand this. Let's give him a time to recover or recoup, and then come back to the session. This is something which is very important for us to know, understand, right? But it is not the case everywhere, right? If you're going to sit in a doctor's office where your child is sick, that becomes a sustained and inescapable environment. You have to meet the doctor, you have to wait. Now, those are the moments. What I would suggest is there is an environment that is going to cause them to be that environment that's going to cause challenges, post challenges for your child, and your child may exhibit behaviors, but you need to be very understanding in those situations and help the child to go through those behaviors or use supportive strategies to minimize those behavior in those environments, right? But if there is an opportunity where you can allow them to escape from that environment, you should be doing it so, right? So that is about sensory escape. Another thing is predictability. Many times, unpredictability and uncertainty, something can cause anxiety, stress, or as they will force them to show behaviors that are inappropriate. No, I would always say that no, the environment has to be predictable. So one of the rules that I have for children coming into my clinic, if they are coming for the first time to my clinic, I would not engage them at all. What I would do is I would allow them to come into my sensory integration unit and allow them to be themselves in that unit. Why do I do that? Basically, I wanted them to get familiarized with the environment, and I wanted them to feel that no, this environment is absolutely comfortable and safe, and nothing is forced in this environment. And then the next subsequent sessions is where I would start evaluating them. So the next subsequent sessions, when the child walks into the clinic, the environment becomes almost extremely predictable for them. So they would be comfortable in the environment. They would interact with you in this environment when it becomes extremely predictable. Okay, that is something which is very important. Sometimes priming them is very important. You prime them and tell them that what is going to happen in the environment. When they're going to a new environment, they do not know what is happening. Getting them ready to expect what's going to come in that environment would help them to minimize those behaviors that they would exhibit. Okay, so coming to a point, what is sensory load? What is sensory overload? Now, if you remember, when we talked about arousal, if a child goes into an over alert state, that is a state where the child experiences sensory overload. Now, how to identify the sensory overload? What are the possible signs that you would identify with sensory overload? Now, I put some of the signs here. Appears to have a high level of activity. If a child has high level of activity, suddenly he starts jumping, screaming, running, and then the movement has become too much. That means he has already gone into an over alert state, and then there is a sensory overload. Now, that is a time what you need to do is you should start intervening and try to bring them to a calm state. If you fail to do that, they will go into a meltdown or a shutdown mode. Then it will take its own course, and it will take its own course, and then it takes time for them to recover. So the most important thing when you see a child with overload, when they show higher level of activity, you should not continue to allow them to persist in that higher level of an activity. You should start using calming strategies to bring them to a calm and an alert state. That is something which is very important. Second one is becomes increasingly distracted and disoriented and confused. If your child is absolutely distracted in your tabletop activity, probably there is a sensory overload. They are not able to focus on your tabletop activity. They are super distracted. Then what happens is they are into an over alert zone. Then what you need to do is you need to stop that tabletop activity, try to use calming strategies to bring them down, right? And the third one is drowsiness and fatigue. Suddenly you see that they are going into a very sleepy mode. Then what you need to do is you need to probably they are shutting themselves down when they go into a sleepy mode. That means from an over alert state, they are going into they have gone to the next level, and then they want to completely shut down. That is where they will show signs of drowsiness, fatigue, and sleepiness, right? Irritability or angry outbursts. They become absolutely irritable. They will show externalizing behaviors like angry outbursts, tantrums. That is also possible when they have signs of overload. Now, shutdown, we have talked about making a poor eye contact, cover their eyes for bright lights, cover their ears for loud sounds, avoids being touched, touching others, constantly changing task, never finishing. Now, I'll talk about this constantly changing task and never finishing in another theme, but please remember this. And then fidgety and restlessness. This is where you will see stimming behaviors, fidgety and restlessness. So you will see fidgetiness, you will see shutdown, you will see increased level of activity when a child has a possible sensory overload. Now, if a child has a possible sensory overload, what you need to do is you need to quickly bring him to a calm and an alert state. You should start using calming strategies that are suitable for your child and bring them to a calm and alert state, right? That is very important. Now, because the child is under responsive, the child loves movement, you cannot keep on doing movement in your session. That is, I will say that is stupidity. You cannot do that. Because what happens is, if a child loves movement, he is under aroused, he is under alert. If he walks into your session, he's going to look for movements. When he starts doing a lot of movements in your session, he would slowly start going from under alert to calm and alert state. And if he continues movement, he would go from calm and alert state to an over alert state. If you still continue movement, then he will go into a shutdown phase. But when he goes into an over alert state, you will see all kinds of problems. You will see higher level of activity, you will see irritability, anger, tantrums, all that would set in. So it's very important for you, when you see them, they are going into an over alert zone, you should stop movements and try to use calming strategies for them, right? So that is why I would say every session is new for the child. Every session, if your child walks into a sensory integration unit or a special education unit, you cannot follow the same principle. You have to look at their arousal level. You have to look at how they are processing sensory information in the environment, and try to minimize it. If you don't do it, they will find their own self-regulating strategy to minimize that overload. Please understand that. If you're not helping them, they will find their own. And when they find their own, that usually would be a stimming behavior, right? So this is one of the young adult with autism expresses their behavior when they have a sensory overload. Now, this is the own words of an autism, an young adult with autism. Now, Laura says that it helps my body regulate the sensory information of the world. So when I stim because it calms me down and regulates the sensory information in the environment. If I don't do that, it goes into an overload. It goes into an overload, shutdown, and meltdown. I don't want to go there. So what I need to do is I need to stim to calm myself down. Now you start understanding how every piece is now coming together, right? So that is sensory overload. The next one is talking about novelty. Novelty is something which you need to understand. You will see in children, there are two kinds of children who can, three kinds of children, but I've put only two because these two are challenging. One kind of children which is not challenging is novelty acceptance. Anything that you give new, they accept it. That is how typically growing children are. But children in the spectrum or children with ADHD will have problems in novelty. So you have two types of novelty. One is novelty resistant, the other one is novelty seeking. What is novelty resistant? They will resist every new thing in the environment, right? How does it work? Now, a child goes to a park and then there is a small swing that child used to do, likes the swing, and then plays with that swing and enjoys that swing. But that same child walks into my sensory integration session. I have a different platform swing and looks bigger. And then when the child looks at it, resists to come and play with that swing. That is novelty resistant. That has nothing to do with sensory processing issue. That is novelty resistant. They would resist every new thing in the environment. Now, if they resist every new thing in an environment, they are going to resist different kinds of sensory information as well. So sometimes I see therapists families mistake that for sensory processing difficulty. It is not sensory processing difficulty. Novelty resistance is a part of the spectrum diagnosis. Many children in the spectrum will resist novelty, but if you expose them consistently, they will accept it. That has nothing to do with sensory integrative problems. So a child, if you see a child who resists novelty, you have to be very careful with them. You cannot introduce new things just like that. If you do that, what will happen is they will go into an over alert mode and then show all kinds of stimming behaviors or all kinds of externalizing behaviors like tantrums, self-injurious behaviors, right? So it's important that you understand this concept very well. If you see a child who is resisting novelty, try to go slow with them. Take time to know, allow them to know, habituate and expose to the things you wanted them to be exposed. That is one thing. The second category of children are novelty-seeking children. What is novelty-seeking? They love new things. These are the children who will have fleeting attention. They will keep running from one room to another room, one equipment to another equipment, one toy to another toy, and then will keep moving from one activity to another without even engaging in one activity completely. These are the children who are novelty seeking, right? Now, novelty seeking children, if you see them at an outset, you will see them as sensory seeking behavior. But I will say that is not sensory seeking. A child with sensory seeking behavior would eventually look for that particular sense and then they would repeatedly seek for those sense. Now, say for an example, if a child loves movement, he would like to go and sit on a swing and then do swings high intensity, right? That is how a sensory seeking child will do. But a novelty seeking child would look for new things in the environment. So they would run from one room to another room, look for the objects there, pull all the objects down. They were not satisfied with any objects. They cannot focus on any object. They have a fleeting attention. They will move from one activity to another, but it is all motoric, right? They'll move from one place to another place looking for different new things. Because they are moving from one place to another place and looking for new things, they would look like they are seeking for movements, but they are not actually seeking for movements. They are looking for novelty, newness, and none of these new things are satisfying them. That is why they have a fleeting attention. They are shifting their attention from one toy to another toy, or one activity to another activity, or one object to another object. This novelty seeking, if you take this child with novelty seeking and enroll them into a sensory integration, give a lot of movements, this novelty seeking will not go away. Because the primary problem is not movement. Their primary problem is they do not have the ability to focus on one particular object or an activity for a longer period of time. So what these children require is, these children require structured environment for them to, structured distraction-free environment for them to help focus on the activity at the time, right? So that is the difference between novelty resistant and seeking. Now you see that there are differences in what you see. A sensory seeking is different from novelty seeking. If you see a child with novelty seeking is pretty common in children with ADHD. They are not common in children with autism spectrum disorder, but it can be seen in spectrum if they have an associated ADHD traits. But novelty seeking is something which you can see most of the times in children with ADHD, right? So that is something which you need to understand, and it is important. But the question comes, can a child with ADHD will also have sensory seeking behavior? Of course, yes. That is a different thing. But novelty seeking is different. This differentiation is very important for all of us to understand. Right, the next one is an anxiety. We talked about a lot of an anxiety and stress, but what is this anxiety is all about? Many times I see children are very anxious. When they are very anxious, they exhibit all kinds of behaviors. It's important. I have seen children when they are anxious show grinding teeth. What you call it as bruxism. They grind teeth when they are anxious. Now you cannot pick them from face. Now many times when I ask family, is your child under any stress? Families will say, I don't see him. Look, he's very happy. I don't think so. He is under stress. Look at his face. I don't pick up any stress from his face. The problem with this kind of an understanding is children with autism does not express their emotions very well. You cannot pick from their face. It's not possible at all. You have to pick from their body language. You have to pick from the kind of behaviors that they do that would help you to understand that no, they are going through these anxious moments. And anxiety can contribute to stimming and other behaviors. Please understand this. That is where now I need to identify, is there an underlying anxiety with this child? Okay, so there is this one particular study by Rogers. He has done a study on 67 young people with autism. He found a strong correlation between anxiety and insistence of sameness. If your child, look at your child, he is insisting you to be same. He wanted the toys to be in a certain place. He wants the toys to be lined in a certain place. He wants the routine to be in the same way that is happening every day. This particular child may have lots of stress and anxiety, even though if it is not visible from the face. Now, it is up to us to understand what is causing them to be anxious and how do we solve this. I have a child. I saw a child probably a year ago. He would come up with a dinosaur toy. Okay, he would not leave the dinosaur toy. The diaper has to be changed by the grandfather. He will not allow the mother to change diaper. The mother is the one who has to give bath, and he has to keep the toys in a certain way. He has to sleep in a certain way. There is one person caregiver has to sleep with them. He will not accept anybody else to sleep with him. That particular caregiver is the one who has to put him to sleep. And then this particular dinosaur toy he keeps all the time in his hand. Now, what is this? This is sameness. Now, when you see such kinds of behaviors, probably there is an underlying anxiety that this child is going through, and it is important for us to identify what is causing this anxiety. And this particular child, we slowly worked on this child, helped the child to overcome anxiety. Now, what happened is after 8-9 months, we have discharged him from the intervention, and he is now into speech, language, and communication, but his routine is normalized. He started accepting things. He started going through predictable, unpredictable routines. Nothing affects him now because he has come out of those episodes, right? So that is very important. And the next one is there is another study that reported anxiety as an intrinsic motivator for repetitive behaviors. When I am anxious, it motivates me to stim a lot because it becomes an intrinsic motivating factor to stim a lot. Unless and until you identify the cause of anxiety and remove it, this stimming behavior will continue. So that is why it's important to find a comfortable zone, comfortable environment for the child to function. If you fail to do it, the child will exhibit all kinds of behaviors, right? So another study again reiterates that repetitive behaviors or the maladaptive coping strategies to negative effect. If there is a negative effect like anxiety and stress, the only thing the child would do, if you are not providing a coping mechanism for them, they will find their own maladaptive coping strategy to live in that environment, right? So that is about anxiety. So again, this particular blog, The Mighty, has recorded 11 young adults. If you go to that Mighty and look at it, 11 young adults with autism, they share their experience about repetitive behaviors. So this one particular young adult talks about stimming. And then Lammer says that stimming is like turning down a radio when you think you smell something burning. It's a way of turning off the other sensors so that you can make sure nothing is burning. See, that is how it is. If you feel something is burning, simple turning a radio on is like take your smell sensors away from it, and then you behave like nothing is burning. That is how stimming is for them. If there is something which is really disturbing happening in the environment, they would eventually do what? They would eventually do something to minimize that in the environment, minimize that information in the environment. It is like if something is burning, I can just simply turn the radio on to minimize it. That is how stimming is like. So for for an onlooker, it looks absolutely not making sense, but for them, it is making sense because they are stimming to minimize something or distract from something or trying to focus on something. Now, that is how stimming is. And anxiety plays an important role in precipitating these stimming behaviors, right? So, and remember, anxiety cannot be picked always through facial gestures, right? That is something which we need to understand. What increases anxiety is compliance. If you demand compliance, that's going to increase stress and anxiety that can result into all kinds of stimming behaviors or other kind of self-injurious behaviors, right? Now, what I mean by compliance? The compliance is I want you to sit here and finish this activity. If you're not finishing this activity, I will not leave you. That is demanding compliance. Now, children with autism do not perform well if you demand compliance. But if you are very accommodative, they really do well. Please understand that. If environment is absolutely unpredictable, which we talked about if you remember the graphical representation that we talked about, predictability is one important factor. If things are unpredictable, they are going to be very anxious. Now, simple example about unpredictability is, now say for an example, you're sitting on a tabletop and you're going to do a writing task. Please remember this, you're going to do a writing task. Now, writing task becomes unpredictable. How it becomes unpredictable? Because the child does not know when this task is going to end. Because I do not have an information when this task is going to end, it puts this task really unpredictable. If it becomes unpredictable, they become anxious and stressful. Now think about it, your child doesn't like writing and the child does not know when this writing is going to complete. That makes this writing extremely unpredictable. First of all, I'm not liking it, but since it is unpredictable, the task is unpredictable, which I'm not liking it, it's going to make the matters worse and the child would start stimming or child would try to distract themselves by looking for other behaviors in the environment. Novelty can cause anxiety. We have seen about it. Sensory sensitivity can cause anxiety. Then I talked about sensory overload that can all cause anxiety, resulting into all kinds of maladaptive behaviors, right? Another one is that can cause behaviors is language difficulties, right? Now, why do I put this? I put a lot of these studies here that talks about association between expressive language difficulty and self-injurious behaviors or externalizing behaviors. Sometimes children cannot have a better way to express you what they are going through, right? And then when you demand compliance, and then when they are not able to communicate because they have an expressive language delay, that can result into self-injurious behavior or externalizing behaviors. What is externalizing behaviors? Externalizing behaviors are aggression, tantrums, and other inappropriate behaviors. They are very aggressive. They become very aggressive because they are not able to communicate to you what they are going through about this particular activity or this particular environment. Now, I have a 12-year-old son, right? Whenever he doesn't like anything, he tells me, Dad, I don't want to do this. Why are you making me do this? Can you give me some break? I want 10 minutes break and then I would think about doing this. So a 12-year typically growing child can express you and tell you what they are feeling about it. But a child with an autism who has a problem in expressive language cannot communicate to you. Then they find a medium to make you understand this. So most of the times this particular medium will be a maladaptive medium, like self-injurious behaviors or externalizing behaviors, right? So it's important for us to understand if a child has an expressive language delay and then they have lots of self-injurious behaviors, then I would say, okay, can we find a way to help them to express their behaviors rather than going into the mode of self-injurious behaviors? That's number one. Or can I understand this child when they are pretty upset and then when they are trying to communicate that no, they are not liking this particular activity? Can I actually understand it and try to minimize it or try to reduce the level of difficulty for them so that they can easily engage in an activity? That is something very important for us to think through, right? So remember, language difficulty, with all the studies that I've mentioned here, this one particular study I've mentioned here is talking about how expressive language difficulty can have an influence on child's behaviors, right? So how to approach behavior? There is no ready-made recipe. First, I would say that read your child. That is the most important thing. I do a lot of time reading. I do less of a treatment, do a lot of reading the child. I keep observing the child, what the child is doing, and then formulate a strategy based on what the child is doing, why the child is doing a certain behavior. So I would simply suggest you to maintain a log about your child's challenging behaviors, at least 10 logs, and review those 10 logs. It would give you an hypothesis of what is causing this behavior. When you identify what is causing this behavior, simply what you need to do is you need to be accommodative, or you need to modify the environment so that the child eases through these behaviors. That's number one. Number two is identifying, number two is do not demand complaints. Don't demand complaints. Many times when I say to the families will tell, if I don't demand, if I force him only, he is not doing it. If I don't demand complaints, will he do it? I would say he would do it. The easiest way for your child to learn is not demanding complaints. That is the easiest way. What is the hardest way? Hardest way is to force them do. Yesterday, I saw a particular child. The family walks in, and the mothers told me this: I have to literally force him for everything. I have to literally force him for brushing. I have to literally force him for playing with other kids. I have to literally force him to do tabletop activity. Then I asked him, if you force him, what do you do? He does the activity. Then what is the problem? She says, the problem is he is not self-initiating. And said, that is the problem. See, with force, you can take a child to a certain level. But beyond that, you would not be able to do it. Now, this child is not self-initiating brushing. This child is not self-initiating playing. This child is not self-initiating tabletop activities. Why it is because all these activities are done by force, and it is not motivating for him. It is not rewarding for him. It is not in his comfort zone for him to do these activities. That is what complaints will do sometimes, right? Now, what would happen is they would become like robots following your instruction, but they are not liking it, right? Now, this is a classical example for no brushing. If you force brush them, initially for a few days, they will resist you. After some time, they will allow you. But that doesn't mean, because they are allowing, doesn't mean that they are happy about it. But if you hand over the brush to them, they would not even do it. Why they would not even do it? Because they are not liking it in the first place. But can I help them to enjoy brushing? That's possible. Can I do it without demanding complaints? That is possible. How it is basically to take it one step at a time, create an environment for them so that they start accepting this process easily. That's the most important thing. So one of the things is sharing control with them. If they know that they are in control of the task, they would generally do not show behaviors. They would automatically do the activities very well, right? For that, what they need to do is you need to share control with them in any form, right? Now, why they do stimming behaviors? Stimming behaviors are absolutely their control. They are in control of those behavior. They know they can do the way they want to do it. They can do how much time they want to do it. That is what control is all about. Can I bring that concept into learning meaningful tasks? Can I give them control to choose them how much they want to do, how long they want to do for the activities that I wanted them to learn? If you practice that, what will happen is they would, initially it would look like they take a lot of time to learn a task, but they are learning it in their comfort zone, and they are learning it meaningfully with their motivation and interest. That is what shared control will do for all your children, right? The same thing goes with use timed activity, miniature sized activity. Don't think that your child has to complete a puzzle, 100-piece puzzle in one shot. No, even if they start learning little by little, they have put only 2 pieces of a puzzle in a day, that should be celebrated as an activity that is accomplished. So start small and start building over a period of time in terms of tolerance and engagement. That is how you start approaching children with autism. When you do that, what would happen is you would minimize all those behaviors that no you see in them, right? So I would stop my presentation and stop sharing my screen. If you have any questions, you can ask.
Hi, doctor.
Yeah, yes.
I'm Susan here. Can I go ahead?
Yeah, please go ahead.
Yeah. So brushing the teeth is something that I actually see in my own kid as well. Right
What
now
is
we
that?
do it brushing the teeth.
Yes, yeah.
Yeah. So we literally have to sort of use a little bit of force. Otherwise, he just does not want to do it.
But no, think about it. No, when you're forcing it, think about it. At some day he has to do it by himself, isn't it?
Correct.
Okay.
Yeah.
Now with your
So yeah, we're not forcing that much nowadays. But then when I think about making it fun, I'm not really sure. Like, can you give us ideas on that?
now, first thing is what I do is any routine, I would create a ritual around it. Okay. Now I would create a ritual around it. What is a ritual? The ritual is this. Okay, there is a brushing ritual. Okay, let's do a brushing ritual. What is a brushing ritual? Okay, the brushing ritual is this. Every day we go to the uh,
Bathroom.
to the sink. You pick up your brush, wash it, put the paste on it, and then you have a brushing action. Wash your brush and put it inside the place. Wash your hands, wash your face, and come. This is a brushing ritual, right?
Okay.
Can you do this without even actually doing brushing?
Yeah, that much he does.
Now that is how it is. That is how it starts. Can he self-initiate this? Okay. That is where I
no, like if I remind him, yeah, he'll start doing it.
Okay.
But
now this requires an ample of practice without forcing it. If without forcing him, you would start doing it, what would happen is you would start understanding this ritual very well. If he understands this ritual very well, then no, the process is falling in place. Now, second thing is what I would do is I would tell him how much time he wants to brush. Okay, that is number one. You give him a control. Okay, how much he wants to brush, how long he wants to brush. Okay, I would not tell him that no, see, you have done it front teeth, you have to go behind. No.
Yeah. So yeah, usually I tell him, yeah, this
I would not do that. I would say how he wants to brush, how long he wants to brush is something under his control, right? The first one is I'm establishing rituals. Second thing is I'm giving control to him. I will also give him control how much of a paste he wants to put. What kind of a paste he wants. He wants this kind of a paste or he wants that kind of a paste. That actually gives him a control. Okay, I am in control of choosing what kind of a paste I want, what kind of a brush I want, where I want to brush, and how much I want to brush. This is the first step to help him enjoy the process. Now, say for an example, today you have given him the control and he puts the brush in front teeth and he did it for 3 seconds and said it's over.
Yeah.
Would you be happy and celebrate it and say you have done a wonderful job? Let's wash the brush and put it back in the cupboard. That is how it starts. When you do that, he starts understanding it. Okay, I'm in control. She respects my feelings and she's happy about it. Now I'm in control. This 3 seconds would soon build into 2 minutes of brushing. It's not going to come more time, but it will soon land into 2 minutes. But the problem is we do not have patience to wait for this. That is the biggest problem.
Actually, in my case, it's been over 6 months. So this part he's doing, and he asked for like a lot of paste. Now he loves the paste.
Love the paste.
Yeah.
But you should also allow him to do how much he wants and how long he wants.
Yeah. So now he's like continuously brushing, just that it's not proper.
Okay.
But
proper will come over a period of time as he practices it. Don't worry about it. The only thing I would say is I would not give a negative feedback about his brushing. I would be always be happy and thankful, grateful for him that he is learning to brush. And wait for him to learn it over a period of time.
Yeah, and another thing that I noticed is like he doesn't like to do it immediately after he wakes up, but if he has like over 20 minutes of, just wandering around, and then he's sort of cooperating and, sort of enjoys it better.
Now tell me, what does that mean? What
I
does
think that
delay
is
mean? Why do we all
basically, I
delay?
think, I think he's getting ready for the
No,
process.
he's not getting ready for it. He is still not comfortable about this brushing. He's not very happy about it.
Yeah.
But delaying taxes is always when things are very hard for you. You try to postpone it, isn't it?
Yeah, correct.
Still, he's
correct.
not comfortable. I would find ways to make it comfortable for him. Enjoy the process. Now, one thing I would be very careful about it is not leaving a feedback while he is doing this process. Okay, one example I will give you is with this one child came a couple of weeks ago. The family said, no, he's not writing at all. It's very challenging to make him write. I said, okay, you wait for some time. I would evaluate him. We sat and I asked him to write. I told him to write from his thoughts. Okay, whatever you think, you write it in the paper. Express yourself in the paper, on the paper. And then I asked him to copy something from a chart that was there in the frame. To my surprise, I saw him completely doing it with a legible writing. You know what is legible? Legible writing is not writing. Legible writing is where you can understand.
Clear. Yeah.
It's where you
You can read it.
You can read it. A third person can read it. The writing was very legible. I was so in not even in one instance, he told me that no, he doesn't want to write. He has actually completed it. Actually, he wrote 6-7 lines. And not even he said. But this 6-7 lines at home is very challenging.
Okay.
You know why? Because I understood that the mother keeps telling him, sit with him and teach him. How did you put the E? Look at it, where it is going.
Okay.
Can you write this word proper? Erase it and write it again.
Yeah.
Now, for him, he starts hating this writing. Okay, why it is because I'm writing it anyway. No, you're going to give me a feedback and feel like no, I'm not very good at writing. Why should I?
Yeah.
Did you get it?
Yeah.
This is a problem. This is what we have to change when we are working with children. That 20 minutes for your child is simply telling me that no, he is not still comfortable. There is a bit of an anxious moment and he's trying to calm himself down. Correct. Before going into that process. Now I will see how do I minimize this 20 minutes and get him straight there. So that is going to be unique. That is something which I have to figure out with him. When I figure out with him, I will be able to help him. Or you yourself will be able to help this when you start figuring this out.
Okay. Thank you.
Hello, Dr. Sundar.
Yeah, yes.
Yeah, I'm Jyoti. I'm a therapist from CCDT Bell Road, physiotherapist.
Yeah, please tell me.
Yeah, so I have a challenging kid who is severely in spectrum.
Okay.
So he shows a lot of aggressive behavior, visual stimming, vocal stimming, and it's all his way of doing things.
Okay.
If we make him sit and do a task, he starts self-biting and pinching the therapist. So he does all this. It's almost a year that he's coming. He's still active. He doesn't want to do a task. It's like there is no instruction control. Is it okay to continue to do like his own way, or should we break that? Because even in school, 3 hours he goes to school, but there also it's his way. Teachers just leave him because he starts screaming. But how the mother today was concerned, like she was saying, he's already 5. How long should we actually wait for this?
Okay, now one important thing is, I also have a child coming to me like this. Okay, so I will speak in reference to my child so that you would pick up what is happening with your child. My child is little more severe. Why it is because he is 9 years old. That means for past 6-7 years he is doing this stimming. He does a visual stimming, hand flipping, and he would find everything and anything to flip. Okay, that's number one. He would do a lot of vocal stimming. The only thing that is missing is no self-injurious behavior. Right? But he is constantly stimming. Okay. Now, first thing is, why does he do stimming constantly? Is because that is something pleasurable for him. that is something which is calming him down, or something which is, it's not really helping him to focus because he is doing nothing. But at least we can say that no, it is something which is pleasurable for him and it is calming him down. He's happy about doing this thing. Correct?
Yes.
Yeah. So what did I start with doing with him is I used a lycra space for him.
Okay.
Okay. I used a lycra space for him. What is a lycra space is? He sits in a lycra. The moment you sit in a lycra, the lycra is going to sag down, right? Lycra is a cloth. It is a stretchable cloth. It stacks down. When it stacks down, what happens is it gives a lot of a pressure for him. A pressure is actually, calming, right? Now, how do I say that pressure is calming? We all use pressure when we have to calm down. Simple example is if you go to a theme park, a theme-based park. Okay, you are very anxious about taking a ride. So you're sitting on a ride. What do you do first? You hold the equipment very tight, as it goes up and down and coming down. You hold it very tight, keep your body stiff.
Yeah.
Okay, now why it is because that stiffness is the one in your body would actually calm you down. The same thing is no pressure. Pressure will calm you down first. But beyond that, because it stacks down and covers him completely, what I first do is I minimize his visual distraction first. I bring him into a visually closed space. So I brought this child to a visually closed space, and suddenly I see his visual stimming stopped. He has got a calming space. There is no much of a distraction. So whatever the distraction in an environment has come down because I've got him into a very closed space. That's number one. Number two is the pressure of the lycra is calming him down. That's number two. Number three is because it's a visually closed space, the visual stimming is good. Now, what has happened is I have dissociated his vision from hand flipping. And the hand flipping was started for some time, but suddenly what I see is he started liking a lot of oral inputs. He started licking the lycra. So what I started doing is I started establishing an oral input for him. I started using safe oral products that he can put in his mouth.
Okay.
And starts organizing him. Organizing him. At some point of time, I was able to see him as adequately has calmed down. That means I've reduced his anxiety level. He has calmed down. The moment he has calmed down, I started initiating an activity like any tabletop activity. Can you fix this? Can you put this here? Can you put this there? Right?
Yeah.
And then he started doing it. Now, what is important here is this I was able to establish in one session. But when this will become a generalized behavior is when this kind of a pattern you start initiating across different environments.
Okay.
Do you get it? Now, if you can empower this knowledge
Yeah.
to the teacher in school, empower this knowledge to the family at home, and we are all in the same space to do this. Then you can ask me a question. Do you expect me to buy a lycra for the child? No, I want a visually closed space. Can I do it with a tent that is there in the house? Yes, it's possible. Now, this worked for my child, but it may not work for your child, but you have to figure it out. But I'm giving you the process, how you are thinking. Okay, let's think in this way and see how it is. I allowed him to start up with, I understand that the stimming is calming him down. He doesn't know other ways of calming him down, but can I find another way of calming him down so that he can stop stimming for a while and focus on an activity? But for me to get him there, I have to get him to a calm and an alert state. If I do not get him at a calm and alert state, he's stimming. See, it's easy for me. He comes into the session, he is stimming. I tell him, okay, let's do an activity. You think what will happen?
Behavior.
His stimming will become more actually. And then he'll become aggressive. That is where no biting all comes in. Okay, you're not allowing me to stem. I'm not able to calm him down. I'm going aggressive. I'm going into an overload. When I go into an overload, I'm going to show you what I'm capable of. That is, I can bite you hard. So when I bite you hard, then anyway, you're going to scream at me and stop. At least think passes for some time, right? And that is what they do. Right?
Thank you so much.
Yes. Somebody is asking a question in the chat that does a headphone will soothe music reducing stimming? I would say yes and no. Probably for some child it will work, for not for all the children. So that is why your strategy for working with the child has to be unique and specific for that child. Because some child is used headphones that reduce stimming, it should not work in your way. That is why you should understand first why that, what is causing the stimming. That is number one. Okay. I would always do this with families. I would say list 10 things that calms your child. List 10 things that stresses your child. If 10 things is not possible, at least 3 to 5 things that calms your child, 3 to 5 things that stresses your child. So you should not be doing things that are stressing your child when the child is already stressed. Okay, and what you have to do is you have to use these calming strategies. That is unique to your child. You don't need to know all the time, give pressure, squeeze hands, and then do no. There are things that your child will like to calm themselves down. Now, say for an example, I like to calm myself down by drinking a cup of coffee. But somebody sitting here would do something else to calm themselves down, correct? Somebody would not like coffee to calm themselves down. That is my way of calming myself down. But that may not be applicable to you. You will say, walking calms me down. Or someone will say, speaking to my mother calms me down. Someone will say, speaking to my friend calms me down. And someone will say, listening to music calms me down. See, there are different variations even among us that we find calming strategies. How do you expect the same calming strategy to work with all the children? It is not going to work. It has to be unique for your child. Okay, calming strategy, not necessary. It should be always sensory. Please understand that. It could be anything that calms themselves down. Right? Now, that is what you need to find. That is why there is a lot of homework and observation. I would say observe your child. The more you observe your child, the more you understand them. If you understand them, everything falls in place. It becomes easy to help your child to grow and bloom. But if you don't understand, it's a problem. Like this particular kid, Jyotirmayi has explained, right? Now he starts biting at some point of time. Why it starts biting at some point of time? Because the stress level is getting higher and higher and higher when you're sitting in a class. I would always say, one thing that a therapist family should understand is when you should do a tabletop activity, when you should use movements. Okay. Now you should know that this child now is in a right state to do a tabletop activity. Then you should initiate a tabletop activity. If he is in an overloaded zone and then you are going to initiate a tabletop activity, everything will fall like cards. That's it. That session will go waste. You cannot do that. That is why I would always say you're a special educator parent or a sensory integration therapist or an occupational therapist or a physiotherapist. Now, every session is different. Every session is unique. Why it is unique? Because you are reading your child and you are understanding where they are, which level they are, and you start initiating an activity based on that level. If you don't do it, your child will perform inconsistently. One day they are happy, one day they are upset, one day they are showing behaviors, the other day they are not showing behaviors. You yourself are confused. What is happening with my child? Today he is good and today he is good, tomorrow he is not good. Yesterday he was very bad. Why it is because you are not reading your child. You are not reading your child. That is one thing. Stop thinking that movements are always beneficial, because if you are going to do movements can easily tip them into an overloaded zone without you understanding it. Then they will go into a meltdown and shut down. Please don't do that. You can give movements to a certain extent, and then when you see them, they are in a calm and alert state where they are started following your instruction, you should start movement and switch to tabletop activity. That is how they would learn to be in that calm and alert state. Right?
Hi.
Yeah.
Yeah, I'm a therapist here. So I just wanted to know, how do you create that lycra space in the clinic?
Anyway, you can do a lycra swing, buy a lycra.
Okay.
Sizes and
Just a swing maybe.
Yes, create a swing.
Okay.
You can buy a lycra cloth and then create a swing by yourself. In the market, available lycra swings are very expensive. Okay, so what I would suggest is buy a lycra fabric and make a swing by yourself. You have these you can buy a lycra swing from the market, and you can buy a daisy chain. Daisy chain is an hanging piece of an equipment. They would use it for yoga. You put daisy chain, you will get it. You can tie the lycra to a daisy chain and then hang it. It becomes a swing, and you can use it.
Right. So, and there's one more thing that I wanted to ask. When these sensory issues get converted into behavior, as in when the child starts doing it for avoiding tabletop activity, is it okay to force them a bit to continue the task? Like, what is your
Force-
opinion about it?
No, my thing is, force will make them do an activity. I will agree with you.
Okay.
But it will not translate into a self-initiating activity.
Right.
Okay. Today, he is doing a tabletop activity, but he is doing it with force and with your instruction. At some point of time, you want him to do without your instruction, isn't it? That is what we are striving for.
Right.
Someday he is going to the tabletop and doing by himself. Force will not be motivating. Force will not be, I should rephrase it like this. Force will not lead to a place where they start self-initiating that activity. So it's not going to, it's like if you force them, they will do it. If you don't force them, they are happy. They don't want to do that. So it will take you to a certain level, but it will not it will not reach you to a place where you want to be. That's the problem with force. That is one thing. Second thing is, force will increase stress and anxiety level. When you force them and suddenly you see them absolutely distracted, showing stimming behaviors, that's the time you should think that you've forced them enough. So what you need to do is you should lower down your challenges. Right. Now, that is why I would do, what happens is, if the child doesn't like it, I would use miniature sized activity for them. Okay. Now, say for an example, we have to write. I will ask the child, how much you have to write. Okay. I'll give them a choice. How much you have to write? I wanted you to write 5 lines. Okay. But you can write 2 lines as well. Which one you want to choose? You want to write 2 lines or 5 lines? What do you think the child will choose?
Maybe 2 lines initially.
2 lines, because that is easy. But when I started the activity, I also wanted the child to write only 2 lines. I don't want 5 lines. Right. But what I'm doing is I'm setting it up in such a way that the child chooses the easiest one. That easiest one is what I wanted to accomplish in this session. Because you have given control to the child would absolutely write 2 sessions and then it's over. And it's over. You should say it's over. Right? Now you cannot say, okay, you have done 2 lines, let's do another 2 lines. No, that doesn't work that way. And it is over, but you can bring them back and another time and make them increase those lines. Okay, now finish. There is another activity we are doing, then we will come back again.
Right. So increase gradually if they're showing behaviors of anxiety and all.
Yes, absolutely, yes.
Right. And also one more thing, like a child can write properly well within a small box also, but only when he's instructed. As in, he wouldn't write, he'll write vaguely everywhere. But then when you tell him that, okay, Sahas, write inside the line, or he doesn't like people to erase what he has written outside the box. And then when you do it, then he starts writing it inside. But after a while, again, he would go vague wherever he wants to. So, like, is that a habit that has formed now? The child is 9 years old now, and he has just started coming to the center. So, I'm not sure. But he can write inside the box, is what I know.
No, he can write inside the box, but he doesn't want to write inside the box.
Yeah, you can say that, yes.
Okay, he doesn't want to write inside the box, probably he's not liking it. Okay, so I would say first question is, what is the purpose of writing inside the box? Okay, now I need to understand this. Okay, now you can say that he doesn't know where to write. Okay, now probably he doesn't know where to write. Now, if you would have attended the previous session conducted by Brain Child Trust, they have handwriting difficulties, right? One of the things they do in handwriting difficulty is you put markers in the paper to cue the child where they should start writing instead of putting a box. Right now, because the child is not going to write lifetime in a box.
Right.
I would not teach him box because no, box is not something which I have wanted them to write. I wanted them to write on a line. You understand that? Now that is where I would know. I wanted them to all the time write on a line. So either if I'm using a chalk and a board or I'm using a paper, I would always use a line for them to write because that is the reference point for them. Okay, now think about it. The child comes to your session, he writes in a box, but he goes to a school, he writes in a he is instructed to write on a line. Okay, a 3-line or a 4-line. Okay, and he comes back home, probably the mother has a single line to ask him to write. This is so much of an inconsistency for him to write, isn't it? Okay, now simple thing for you to teach writing is a single line. Single line is the best method to write for children who have difficulties in handwriting, who cannot write. That's as simple as that. Now, I does not recommend 3-line, 4-line, whatever line it is. I don't recommend it at all. If I see a child as struggling and then the school is demanding them to write 3-4 lines, I generally mail them requesting them to shift the child to a single line. When you shift them to a single line, actually writing improves, child is happy and they are able to follow very well. Why 3-line is difficult for us is because too much of an instruction, where to end, where to come down, where to go. It's very difficult for a child to follow. Single line means they understand it. You have to write on the top of the line, that's it. The writing has to be legible. There's writing should not be, as accurate as everybody will write.
So that is what I was about to come to. Like, I had asked him to write on a line as well. Like,
okay, I think we will share the links to all these previous sessions as well.
Okay.
We are running out of time. We just have another couple of minutes. Sorry to stop you there. So
no problem.
Just one more question and then stop for today.
Ma'am, one question from my side.
Yes, Ashu.
Hello, sir. This is Ashu.
Yes.
This is a very informative session, sir. It will be similar from the previous question. Maybe it is like you said no restraints and no compliance. I understood completely the concept what you told.
Okay.
But there are some cognitively good kids who have learned, who are communicating well.
Okay.
But then when we go along with them, they start ruling us. It is like they know what is to be done, what not to be done. They'll understand, and then they will be like, whatever they want has to be done. And this is everywhere in the surroundings, at school, at home, at clinic also. So is compliance not good for them also, or how to control them, or how to regulate them? Maybe.
No, this is something which we have discussed. Okay, now if you give control to them, okay, they will actually do it. Okay, now you don't need to control them. You should, whatever activity is there, you give them some amount of control in that activity. Right, now that is what I talked about. Okay, now even cognitively good kids. Okay, now there are children who come to me. I would say, okay, we are going to do jumping jacks. We are doing jumping jacks. They'll say, no, I don't want to do jumping jacks. I want to do this. I want to sit and play with that toy. I would say, okay, now is jumping jacks. Probably that toy is there in our list. Look at the list. Our toy is there in that list. But now we are doing jumping jacks. Now I will give you a choice. You want to do 5 jumping jacks or 20 jumping jacks? My choice is 20 jumping jacks. What is your choice? You think same thing what we did for brushing, right? The example that I've given. What do you think your child will choose?
He will choose 5 only, sir.
That is what I want. I want him to do 5 jumping jacks. Okay, I will say, let's do, okay, I want 20, but I'm very sad that you're doing 5. Okay, let's do 5. And then I want him to do 5. I want him to do jumping jacks. I wanted him to do 5. But I've created a choice for him to choose something which I wanted without even him knowing it. Is because I am sharing control with him. he is in a driving seat to choose how much he wants to do. When you do that, they will automatically do. Even if your activity is difficult, they will do it. But if you're ready to share control with them, rather than you are problem with the therapist is you wanted them to follow all your instructions to the core. That is the problem. If you do that, they will always resist. They'll always resist. Now, even with bigger kids, this is the most important thing. You should be ready to share control with them. You should give the power of control with them. You give the remote to them. They let them operate it. But you set up an environment in such a way that no, what they are operating is what you wanted them to do. That's how it is.
Okay, sir. Thank you.
Yeah, in view of the time restraint, I'm afraid we have to end this session. So over to Varshita.
Hello, everyone. On behalf of all the participants, I'm expressing my gratitude here today. Firstly, thank you, Dr. Sundar, on this knowledgeable, informative session and extending your valuable time. It was very informative session. This definitely adds to our learning and practice hereafter. So, and thanks to all the participants for your active interaction and your questions. So last but not the least, thanks to Brain Child Trust for Dr. Gauri and Ms. Apurva for organizing this webinar and this as a topic. And all the team members of Ask the New Kids, thanks to all for being the background team member. Thank you. Thanks once again. And the entire session is recorded. It will be available in the Brainchild Trust YouTube channel. So once who has missed or wants to rewatch, it's definitely there on the YouTube channel. Thanks again. Good night all.
Thank you. We'll end the